record. So this morning, I want to introduce to you our three panelists. Danielle Vaughan is a doctor of physical therapy. She and her husband own PhysioFit, North Carolina. Hi, Danielle. Good morning.
Good morning.
We also have Jaclyn Qualter, who's a nurse practitioner. She's the owner of Login Clinics, another great chamber member. And right now she's down at NC State. They've been thermo testing construction workers since 6:30 this morning. Isn't that right, Jaclyn?
Yep. Yep.
So talk about some of the new weird things that people have to do in this pandemic. Go and take men's temperatures so they can go to work in the morning. So anyway, Jaclyn, thank you so much. Jaclyn's going to talk to us about the rise of telemedicine in the face of all this. And we also have Alana Casey, who is a dietitian with UNC Health Alliance. Good morning, Alani.
Good morning. How are you? I'm
fine. You're the only one that I haven't met before, and I'm just thrilled to hear. And I wore a special shirt just for you. See that? That's for Alani.
That's awesome.
So I did get dressed up this morning. I have a t-shirt on with my leggings instead of just a tank top. So Danielle, you are going to kick us off with some sort of interesting exercise that we can do from our sofa or our desk. So I'm going to turn it over to you.
Yeah, so I figured everybody's probably sitting around their computer a little bit more than they usually do. So I figured let's go ahead and do a few exercises, some of my favorites that I'm actually doing a lot more recently too. But you got to actually stand up because we want to try to get out of our chairs as much as we can if we're sitting a lot more. Let's see if I can angle this a little bit better. But anyway, so what I want you to do is if you take a big step forward, you want to kind of get into a lunge position. So a lot of times when we're sitting, our hip flexors get tight. So if you get into a lunge position and you're going to lunge forward and you're going to really try to drive that back hip towards the ground, and then you're going to bring your arms up. The arm that is with the same as the back leg, you're going to have straight up towards the ceiling. You're going to take the other hand and grab around the wrist, and you're going to pull the opposite direction. So that should really help open up that front area. Take a couple deep breaths in. You should feel that really stretching in that hip flexor and opening up those ribs. And then coming out of that position and then switching legs so we're nice and even. So I now have my left leg back and my left arm up and my right arm is grabbing and pulling. I don't have the full body view here, but working on it.
That feels great.
That's one of my favorites. And then another one that I really am doing a lot of now recently too is mostly for your adductors. So if you get into like kind of straddle position with your legs and your feet pointing out, getting into almost like a squat position here, you're going to place your hands on your knees. You're going to actually push your knees apart and try to lift your chest up. And then I want you to rotate towards the right, and you're going to actually turn your head and your body towards the right, so you'll be pushing that left leg more away. Another one of my favorite ones because it really gets that spine to rotate. And a lot of times after sitting for a while, we get really tight in that mid spine. Actually got a little pop in my back and then going the other way.
What's the ideal time to hold the first stretch as well as this one?
Yeah, so, I mean, the 30 to 60 seconds is kind of ideal. That last one you did, sometimes I'll only hold about 10 seconds and I'll go back and forth about 3 times each way because the actual movement in and out can really help, especially with that adductor, and it gets, again, that spine moving pretty well.
That was nice. Thank you.
That was great.
That was good. So I had some
we're awake already.
looking at me weird here.
Thank you, Danielle.
Yeah, absolutely.
All right, Danielle, let's start with you. I've got a few questions if you don't mind. And then for everyone on the call, feel free to jump in. And hey, Becca, hey, Annette, it's so nice to see you. Jennifer, great to see you. Janice, great to see you too. How fun is this? You know, we're a small group and we're all friends. So if you've got a question for any of our panelists, just jump in and ask it, or you can always use the chat feature if you don't want to interrupt them. So I'm glad to have everybody here. Danielle, start out with just what is a women's health physical therapist so that we all understand what's the difference.
Yeah, so women's health physical therapist. So I treat a lot of pelvic pain and issues. One of the main things is urinary incontinence. So a lot of times when people cough, laugh, sneeze, might leak a little bit, very common pregnancy, postpartum, and then even along the whole lifespan. I also treat a lot of women with pelvic pain, back pain, hip pain, things that might be related to that, diastasis, abdominal separations, weaknesses. I see a lot of women in postpartum getting them back into their exercise routine, trying to rebuild up that pelvic floor, their base core strength, and retraining those muscles.
That's so interesting. So really it does stretch from the entire age continuum, issues that people may have to bring to you.
Yeah, well, even so, I've been practicing for about 10 years, and even in those 10 years, I've seen a huge change that a lot of, like in countries, France and Canada always refer, as soon as you have a baby, you refer to a pelvic health physical therapist to just get an assessment, get some exercises. Sometimes it's just one session, it's there, and then you go. And they found that in that 5th and 6th decade, which we see in America, when women really start to have sometimes more of those pelvic issues, that they're stronger because they, worked those muscles a little bit earlier and integrated those muscles, and they didn't have as many problems. So we're seeing that even in America, it's starting to, so it's kind of a neat part of our field for me to be in right now, because I'm really seeing it grow and thrive, and seeing the impacts that it has on women later on, because your pelvic floor is your base of your core, right? So everything you do, from sitting to standing to squatting to lifting to jogging to everything, you need to have that little bit being able to kick in that muscle, and it should just work regularly.
Yeah, that's really interesting. Going back to just general exercise, we all know there's lots of great benefits to exercise, but what if it's painful and we feel worse after we exercise? What are we doing wrong, or what's going on?
Yeah, so that's, exercise, like you said, everybody knows that everybody knows that it helps with their heart health and our lung health and our muscles and all that kind of stuff. But, so there are obviously some times where people exercise and then it creates more problems, even though the benefits are always better than the risks. But, we see that a lot more in like chronic injuries. Say, take your knee. Like a lot of people have knee pain. They're like, well, I didn't sprain my knee, I didn't fall, I didn't twist it, but just over time it starts bothering me, or when I walk, or when I run, or when I do weights, and I don't like to exercise because I have pain. And a lot of times those things aren't from an actual injury, but maybe certain muscles that aren't working the way that they're supposed to. Take the knee example. If you're doing a squat and you just feel it in your knee, instead of working your quadricep or your glute muscles or things like that, you're just kind of picking at that spot. So in time, it starts to bother you, more and more, and then it becomes painful. So kind of learning how to retrain those muscles and get them to work appropriately, because it's not always just one instance, one thing that you did that created that pain. It's kind of always the mystery diagnosis when people are just like, well, I don't have a tendinopathy. There's not like a great diagnosis for it, but they just have pain. And it kind of goes back to a lot of even with the women's health, and being able to identify having that good core strength and that core stability can be really important too.
Are there any special considerations for women versus men with exercise during our lifetime? Have you seen that, experienced it? What are the differences?
Yeah, so I mean, when a lot of times when we're like, well, I'm trying to find the right routine for me, or what should I be doing? And I mean, I think the short answer is always whatever you love to do, what makes you happy, because you're going to be more likely to do it. But a couple of things to consider, for women, one of the main things is even like osteoporosis. We're a lot more higher risk of having it. Our bones actually start to get a little bit weaker starting at age of 24. So one of the best things you can do is something that's weight bearing, some strengthening. And I always try to implement that with women instead of just being cardio focused. Some people just run or just want to sweat or just want to get their heart rate up, which has got a lot of benefits, but incorporating some kind of weights resistance to help build up the bones. a little bit more. And then of course, there's always the, being mindful for our core muscles as well too. There's a saying that you can't shoot a cannon from a canoe, right? Like you got to have that base support in order to get a lot of that strength and that power. And especially women that have had, babies, just right, making sure that they're restoring those core muscles and the pelvic floor muscles. Because what's interesting about the pelvic floor and some of those deep core muscles, you don't feel them like you would a quadricep or a bicep. Like those muscles aren't as strong. You're not as aware of that. So just relearning how to integrate those muscles into your exercises and makes a really big difference in the long run.
That's really interesting because, well, I've been going to fitness center and all those sorts of things for a long time, and we do a lot of strengthening and I do a lot of muscle exercises and that kind of thing. But the whole pelvic floor business just really doesn't come up in your standard gym class.
Sure.
So that's interesting to have to pay more attention to. We're kind of past the allergy season, or I don't know whether we are or not. Thankfully don't suffer a lot, but kind of sometimes we laugh about peeing when we cough and we sneeze or we jump around. Is that normal?
Yeah. So it's really common, but it's not actually normal. So, again, with the pelvic floor, having that base core stability and strength is so important. And it's something that so many women actually have, and we do typically kind of laugh about it or maybe don't talk about it or whatnot. And therapy has a really strong role in that. And we just restore that muscle strength and it goes beyond Kegels. I mean, so many times people are like, oh, I'm doing my Kegel exercises, but that's not, sometimes those muscles aren't timing appropriately or whatnot. And there's some great tools that you can use. For instance, if you're going to cough or sneeze, even just trying to contract that pelvic floor right before will actually limit about 70% of women in having some leakage with that cough and sneeze. And just because it's the timing, that muscle needs to be able to contract and support when that inner abdominal pressure increases with a cough and a laugh and a sneeze or whatever. So yeah, it's something that we see, like I said, throughout the whole lifespan. It's really common, but luckily it's something that we can address pretty quickly with just some easy exercises and just some base knowledge.
Cool. That's very interesting. So thanks. Hang on. We'll get back to you. I want to ask Jaclyn a couple questions. So Jaclyn, you started log-in clinics in January 2019, I think. And can you just give all of us a better understanding of what telemedicine is and how we can use it to improve our overall health?
Sure. So telemedicine, there's a lot of tele everything now. And it was funny when I first opened, so I opened in September, but when I first opened, my focus was let me teach people what telemedicine is, because there was a knowledge deficit, I think, and there still is a little bit, but now it's sort of become like a trendy word, don't go to the doctor, use telemedicine. So I'm thankful that people know what it is a little bit more now. It's unfortunate that it had to come along with the national emergency pandemic that we're having. But so you can put tele with anything. So there's teletherapy. So it's doing therapy at a distance is sort of the proper definition of it, if you were to look it up. And then telehealth is providing healthcare at a distance. And then telemedicine is providing medical care at a distance. And so in my practice, we do have a teletherapy component, and then we also have telehealth or telemedicine. And my practice is both of those, actually, because I do have a concierge arm where there are patients who have, 5 or 6 doctors, and they feel like they're not getting enough individualized care from their physicians or their providers. They take a long time to be seen. They go in, they're in for 20 minutes. They feel rushed. They don't feel like they've had their questions answered. And then they leave and they forget like about half of what they heard, and they still have questions afterward. And then they're trying to reconcile, what their neurologist said with what their, cardiologist said. And it just becomes very confusing for people. And I find that people that are educated and want to really, be involved in their health, they find the current system frustrating. And so I have some concierge patients who they pay every month, and I set up a meeting routine schedule with them, even if they don't have issues, just to go over kind of where they are in their health goals. And, okay, you saw your cardiologist here. Did they, because sometimes things fall through the cracks. You should be going back, in February. Is that appointment scheduled yet? And, I have all their old records and everything. So I review all of those, and I know them, and I make a point to meet with them every month. Like, we are going to meet every month, even if you're fine. Like, that's part of the plan, just to kind of go over everything and make sure, we're on the right track and that I can address anything that you may have. And I have text messaging that goes along with it that's HIPAA compliant. I have another application that I use. And so if they need to get a hold of me, they can simply text message me, and it's a little bit easier if you're busy and you're running here or there. And sometimes making a telephone call now, I think, can feel so overwhelming. Like, I don't know why, but it just does, because it feels like it takes longer than to just shoot off a quick text. So I try to make it easy for my patients. So and then I have a urgent care, essentially, like arm of my company where anybody can use it. They just, if they need a medication refill, they can't get into their doctor, or, there's something relatively uncomplicated that we can do using telemedicine. And a lot of that is very, very possible.
That's really interesting. I had no idea about the concierge service. So you can just keep up with somebody and their issues and make sure that they're staying on track. I think that's fascinating. I was thinking more about telemedicine, and I've got a sore throat, I'll hold my phone up to my mouth and you'll look in my mouth and go, yeah, you've got strep throat or whatever. But tell us a little bit about how you can actually diagnose people using telemedicine?
So I think that a lot of people don't quite, understand how that works. And when you go into the doctor, they feel, they touch, they listen. So there are some limitations depending on the system that you use. Right now I'm working on setting up with a remote clinic in Eden, North Carolina, with having a kiosk that has an electronic FDA approved stethoscope. And so the medic will hold it, in the right place and then send me the audio file. So essentially the medic is being, my ear, like sending me that. And then also there are devices that go along with it that have a tongue depressor and a camera that take the picture, the otoscope and a camera that take a picture. And so those things just come electronically. So that's where like my goal is. That's where I'm aiming to arrive with my telemedicine. But people still would have to go to a facility, or they would have to have some sort of their own package, which exists. I am trialing that with family that I know. They're taking, and it has the otoscope, the ophthalmoscope, it has the throat thing, and then we're seeing how that goes. Their own little package at home that they use to communicate with me. Yeah, so I have the patient, like I'll teach them how to feel for their pulse if they don't know where it is. Often people have Apple Watches, so they can tell me what their pulse is. Some people have blood pressure cuffs. Most people have thermometers, so we can get like kind of the basic vital sign for minor illnesses. And then I, have them palpate. This is where your lymph nodes are. I'm going to show you how to do it. And then I have them kind of tap their sinuses. And then I have, as well on the HIPAA compliant text messaging application, the ability to send images. So video quality varies from person to person, and the lighting, if you look at the screens in front of you, there are various, there's various visibility, right? Some people have better cameras than other people. Some people are in a low lit room. And so there are certain things that you just don't think about as a, when you're on the other end, right? That I really need to see. And so we'll use camera. They'll take a picture. They'll send me a picture. I've got some really great pictures of the back of people's throats. I mean, they're great photographers. They can send some great images. So I find that helps with the limitation of the video. It just takes a little extra time, but I think most people are okay doing that, as opposed to going into, urgent care and waiting for a couple hours to be seen.
Sure. Well, this is a women's health panel. So what kind of women's issues do you see frequently via telemedicine, or do you?
Yeah, so I wrote down a list because I was trying to think of what is female specific. So women struggle a lot with UTIs, more than men, obviously. Thyroid issues, really what I'm seeing more of right now is more anxiety or depression, nothing where, we need to, send them to a facility, but just like the normal kind of dealing with everything that's going on around us, which is very stressful and which is very anxiety provoking. And so I can help with things like that, with, you know, organizing therapy, or, you know, doing inventories. Like I take inventories on my patients. There's like an inventory for anxiety and inventory for depression. And then we follow up and we can see how things have gone once we've started a first line antidepressant. And I always recommend yoga, Danielle. I love yoga. I think yoga is great. I think it helps with being mindful and with deep breathing and relaxing your muscles and all this. So I try to be holistic in how I think about things, because I'm not a huge medicine fan, but I know medicine does have a role and it can be very helpful. Backaches, strep throat, sinus infections, you know, allergies, sprains, strains, like there are things that are common to men and women. Birth control, like that's a women's health thing, and that's relatively easy to do via telemedicine. And skincare, I've been getting a lot of skincare, which is funny because I don't, you know, advertise skincare, but yes, I can write prescriptions for skincare that dermatologists can write for, and it's pretty straightforward, like the basic kind of stuff that's a little bit stronger than Rodan and Fields. And so I have been getting some people with requests for that. So that's fairly straightforward.
Oh, that's interesting. Well, thanks again for joining us. I'm going to move on to Alani just so we get everybody have a chance to talk about their area of expertise, and then we'll come back for additional questions. So Alani, you're a dietitian. I bet the very first thing people want to talk to you about is, I need to lose 15 pounds or 20 pounds. Help me with that. So what is, in your opinion, the best diet for weight loss?
So that's a really good question. And I do get this all the time. What diet can I go on? And I've heard about this diet and this diet. And there's so many diets that I haven't even heard of that people come in and ask me about. I'm like, can we just hold on a second? Let me look this up. I have no idea what the Budwig diet is or whatever. And so generally speaking, what the research is showing is that there's no specific diet that is like the end all be all, like this is what you do to lose weight or anything like that. It's more of just a well-balanced diet that's relying on moderation. It's not like, you can't ever have pizza or you can't ever have chips or like your Starbucks specialty drink or anything, but those things you want to focus on in moderation. That's the key word there, and balance. So having a diet that's, and by diet, I mean like a whole, lifestyle, not just like a specific diet. Having a diet that's rich in whole grains. And there's loads of different types of whole grains out there too. It's not just brown rice and whole wheat bread and whole wheat pasta. I mean, there's quinoa and amaranth and bulgur, buckwheat, farro. I mean, the list goes on and on. There's oats and just loads and loads of different types of whole grains. So experimenting a whole lot because each of those grains have different nutrients in them. So whole grains, are really important. I think in this day and age where, low carb is so kind of sought after and popular nowadays, I can't stress enough, like grains are really important and carbs are important. We just need to be careful with what kind of carbs, like, chips or quinoa kind of thing. And then also focusing on, fruits and vegetables, low-fat dairy, all, lean proteins, animal, lean kind of sources of animal protein, and kind of limiting our red meat intake and increasing our seafood intake and our fatty fish intake and our plant-based kind of protein sources too. So all those kind of, having a really well-balanced diet with a whole mixture of those types of things and mixing up your foods too. There's totally like loads and loads of different types of foods out there. And we kind of tend to get stuck in our favorites and, have those specific foods kind of, on a cycle, and experimenting with different foods so that you can get a variety of nutrients is really important and really great and fun too, and confusing sometimes. Because you're like, I don't know what to do with this chayote that I've never seen in my life before. So yeah, a whole well-balanced diet with lots of natural foods.
What's the deal with keto or ketogenic? I don't even know how to say
Oh
that.
yeah, the ketogenic diet. I get this all the time. I'll have people come in and say, oh, I'm on the ketogenic diet. So a little background on that. the ketogenic diet is, or the keto diet is really, really popular now, but it's been around for a really, really long time. It's a very, very low carbohydrate diet. And there's different kind of levels of that too. You can do a low carb, which is more like Atkins, or very low carb, and very high fat. And so that has been around for almost a century actually. And it was originally created for people who, for children who have epilepsy. To reduce their incidence of seizures. And they showed that it worked. And so what happened was they were also showing that these children were losing some weight. And then it kind of went mainstream and they were like, oh, people are losing weight. So essentially what happens with the ketogenic, a little pathophysiology here, our body, we were made to kind of process carbohydrates, and we eat those carbs and they break down into lots of different things, but they break down into sugar or glucose, which is one of the most simple forms of sugar. And then our body kind of uses that and absorbs it and converts it into energy. And we use that to eat, breathe, sleep, blink, speak, move, everything. And so what happens is if you're cutting back on those carbs, our body's like, what the heck, what am I supposed to do now? And so they turn to the fat in our body and they start breaking down the fat, and that breaks down into what we call ketones. And they use those ketones as energy instead. And so that's why people start losing that weight. But what happens with the ketogenic diet is, A, it's not studied for long-term effects. So we don't know kind of the long-term effects of shifting your entire body's metabolic process from carbs to fat, which we're not made to process. And so we don't know kind of the long-term side effects of that, but we also know that it can affect our blood cholesterol levels. So our total cholesterol, our HDL, which is our good cholesterol, our LDL, and our triglycerides, which are bad cholesterol. And we've seen that when people are on the ketogenic diet, our cholesterol levels get shifted and not in a good way, which can affect our heart health, and lots of other things too. Besides the fact that we feel really sluggish and kind of tired all the time, and you're cutting out a lot of fruits because fruits are carbohydrates and whole grains, so you're missing out on loads of nutrients. Avocados are great, they're awesome, but we should have a well-balanced diet, not just like avocados and bacon and eggs and fat bombs.
Well, I personally could live on avocados anyway.
I know, me too, I love them.
So you're saying, because it has been a big fad over the last few years.
Mm-hmm.
Certainly low carb, no carb, keto, but may be effective in the short term, but for overall health, probably better to stay away from it for the long term.
Absolutely. Yeah. And that's a good point too, is because I see a lot of people, it's not sustainable either. You can't go for really long periods of time just eating high fat foods and really avoiding or limiting carbs that much. And so a lot of people will come in and they've been on the ketogenic diet for however long, maybe months, maybe a year even, and they've lost this weight, but then they gain it back because it's just not sustainable, and they gain it back even more. And then we're in that yo-yo dieting, what I like to call up and down, and that can wreak way more havoc on our bodies, going up and down in our weight, trying all these different diets that aren't sustainable, than just going, slow and steady and really kind of honing in on that well-balanced diet.
Well, so we're a little disappointed you didn't come this morning with a silver bullet for us.
I'm sorry.
So you're basically telling us to do what everybody's always recommended: have a well-balanced diet, whole grains, fruits and vegetables.
Yep.
Okay, well, anyway. How do our nutrient needs change over the course of a woman's life? What changes from a 16-year-old to a 66-year-old?
That's a really, really, really great question. So in our nutrient needs change so much, depending on from birth to as we get older. One of the biggest nutrient needs that changes is kind of iron and folic acid. When we're in the childbearing age, we want to make sure that we're getting more of those types of foods, especially, premenopause and when we're still menstruating, we're losing a lot of iron in our blood. And so we need to supplement with that, and not supplement with kind of a supplement, but just having foods that are really rich in iron. And so we need more iron during those times versus especially, if we're pregnant and we're breastfeeding, having more iron and folic acid during those times, it's really important. They can prevent a lot of, especially folic acid, neural tube defects and birth defects from the child. And so making sure that those nutrients kind of go into the child when we're pregnant. And then afterwards, after we're finished, bearing children, breastfeeding and all that kind of stuff, our iron and folic acid needs go down, and then they kind of decrease after menopause as well. In addition to that, calcium and vitamin D increase as we age. And so we need more calcium and more vitamin D for our bone health. I think Danielle mentioned osteoporosis is a huge risk for women. And so we need more of that as we age to kind of decrease our risk for osteoporosis and maintain our good bone health as well.
Interesting. I'm in my 60s. Can I have too much iron, or is it just I needed it more when I was when having my children, but now as you aged, can you have too much of anything?
You can. It's not very, it's difficult to get too much iron, to be honest, because we don't really eat that much iron in our diets.
Nobody eats liver anymore.
Yeah, nobody eats liver anymore, exactly. So it's really hard to get too much iron, but it isn't impossible. And so I would definitely recommend, when you're going to visit your healthcare provider and you get your labs done, getting an iron panel is what we like to call it. So getting, check for your iron if that's necessary. And a lot of people don't really need, a supplementation or anything like that. But if you're having a well-balanced diet, you're probably not getting too much iron anyway.
Here's a random question that I've always believed, and sorry everybody, you're gonna have a chance to ask questions in a minute. We cook almost every night in some version of a cast iron pan. Mm-hmm. And is it true that we're getting little bits of iron from cooking in a cast iron pan? So that's
absolutely. Yep, absolutely. Absolutely. Yep. I love cooking in a cast iron. I think it's awesome. I recommend a lot of people cook in a cast iron skillet. The only downfall is like the cleaning part, because I'm such I need things really clean. So I'm like, do I just gently wash this and wipe it with oil? That's so weird to me. But that's just my, personal opinion. I love cooking with a cast iron skillet. And yeah, I recommend that for a lot of people, especially, if they're low in their iron. That's a great way to get a little extra. Yeah. Good question.
That's good. I thought that was kind of an old wives' tale. It's good to know that it's true.
Yeah, it is. It sure is.
So, Alani, what foods can we eat as women that will help reduce our risk for heart disease?
Oh, another really great question. So, really, it all goes back to that well-balanced diet. We want to focus foods that are really high in fiber. Fiber helps with so many different things, but it also helps with those kind of cholesterol levels that I was talking about. Lower those bad cholesterol levels and increase those good cholesterol levels. So foods that are high in fiber are whole grains, fruits, vegetables, those types of things. And then limiting your intake of really bad fats, so saturated fats and trans fats. Saturated fats are those fats that are found in kind of animal fat, so the skin on the chicken or poultry, the fat found in beef and pork products, fat that's found in dairy. So that's why we always recommend low fat or fat-free dairy products. So you want to limit butter, those types of things. You want to limit those as much as possible, and then increase your good heart healthy fats that are great for your heart, that kind of do that reverse as well, that increase that good cholesterol level and lower that bad cholesterol, those bad cholesterol levels. And those types of fats are found in, they're called omega-3s and omega-6s, so poly and monounsaturated fats. They're found in seafood, fatty fish like sardines, or salmon, tuna, mackerel, those types of fish, peanut oil, which is really great, or olive oil, canola oil, nuts and seeds have a lot of good heart healthy fats. Avocados have a lot of good heart healthy fats. And so those are all really great ways to kind of reduce your risk for heart disease.
Great answer. Again, going back to that same old diet that we're supposed
to diet. Exactly.
Well, thank you for that.
Sure.
So those are all the questions that I had prepared ahead of time. So everybody on the call, what questions do you have for Alani or Danielle or Jaclyn? We also have Susan Berquist on the phone, who's an audiologist. So if you happen to have a hearing related question, we happen to have an expert. Susan, thanks for being here this morning. Other questions regarding, go ahead.
Hey, good morning, everybody. My name's Jen Hallman, and I work with family attorneys. I'm our community outreach director. I think it's been publicized pretty much that we're seeing right now the courts are closed, so we're not doing a lot of trials, but we handle everything from adoptions to wills and estates, and of course domestic violence falls right in there. We're seeing a huge uptick of both men and women calling about domestic violence issues or child custody issues with one parent not returning children. The only time the courts are open are for those emergencies. So, I've researched what's open. I'm sending women, of course, first to the police, second to groups like Interact or different groups in Johnson County or Franklin County where they can get physical help with how to avoid their abuser. And then we also, as family lawyers, always refer them to a family doctor or therapist. But could any of you add some sort of outlets or things that benefits that I could resources that I could refer them to, insofar as their mental health, insofar as their physical health? I mean, do you recommend any sort of exercise for that type of stress, or is there some sort of medical treatment that you, besides normal therapy, that you recommend for that type of stress for children and adults both?
Gosh, what a powerful and great question. Goodness. Danielle, Jaclyn?
Yeah, I have a couple things to say on that. So I unfortunately, a lot of times with especially sexual abuse, pelvic pain is a big thing that we do see. So if you ever find that you have somebody that is looking for somebody who can address that, I definitely would be a resource for you for that. And even you're talking about exercise, and unfortunately things are all still closed, but there's a lot to be said for a small group class and being able to build emotional support and trust is a big thing too, and trying to find something that has smaller group class sizes or where people might feel comfortable. Again, my point wasn't to just talk about the things that we have here, but we have small series, which are a great avenue where people get to know each other from the start to the end, versus like a big group class size or a big group gym, for those kind of women. And then we have some family yoga and other things like that. But yeah, I think getting out and exercising has so many benefits mentally and physically. I'm sure you guys have been out, and there's just people everywhere, just outside, just getting that fresh air and exercising, and it's endless amount of help.
Thank you. Jaclyn, do you have anything to add to that? We can't hear you.
I think this is a very, very complex question that you asked, because my brain is just going off in like all these different directions. And, it depends on it sounds like you're making very good referrals and recommendations for your clients. Domestic violence and abuse can be just so wide in variety of how it looks and how the children are affected and the spouses and things like that. So it's good that you're referring to therapists. I think that's very important. I think, my practice has like I said, a therapy component and medicine. And so, we do both of those. And so I work very closely with my therapist friend. She's a licensed marriage and family therapist. And so there are different types of therapists, and with different types of training. You can go to a social worker, LPCA, a licensed professional counselor, play therapist, right, for kids. And so I think that it's important to get the right therapist depending on, what you're dealing with. And the therapist I work with at Login Clinics, she does family therapy, couples therapy, individuals therapy. She definitely focuses more a little bit on women because she is a woman. But she does also have work with PTSD. Very, very smart. I feel like people need therapy if they're safe, right? If they're safe to stay where they are, they need therapy for sure. And then also some medical adjunctive pharmacology can help, right? So, for short-term anxiety, depression that everybody deals with just in their lifetime, I think we need to normalize it a little bit more than what it is because it's very normal. Then, I can help with that as well. And I think it sounds like, your clients would probably benefit for having a more individualized treatment than just, showing up in a doctor's office. And I feel like, that's often what we provide our clients.
Hey, Jennifer, can I chime in here a little bit? Hi, Jennifer. Jennifer and I know each other from the Business Bureau, and it's so nice to see so many of your faces, so many professionals, and I'm getting so much out of this. So thank you, ladies.
Hi, Janice.
Hey. So have you contacted Alliance Behavioral Health? Because they are funded by the March of Dimes, and they are the ones that distribute, all of the funding. So there are 3 ways to find, help. There are like homeless shelters, and now the homeless shelters are closed, but they will find a hotel, for a person who just has to sort of be still social distancing, but needs a place to run away and hide. And they will find not only the place, but then your toiletries and, money and protection. And it's basically a combination of state funding and March of Dimes funding. And, it's a great resource. So if you need a phone number, I can give that to you. I don't know if you've already contacted them. And a lot of people don't know they exist.
Yeah, go ahead and send that, Janice. I believe we have a director of client services that reaches out. I know we're working really close with Interact and a couple other groups. But it never hurts to have another resource just to make sure we're taking full advantage of it.
Sure.
It's incredible to me. We see domestic violence all the time. I have never seen anything like this. And not only is it hard on them, but it's hard. We have an almost all family law firm, or all women law firm. And we have 5 attorneys. We have 20 employees, except for exceptional one, they're all women, or mostly over the age of 50. And the type of stress that this is causing with our employees is really tough too, because we're not seeing any of the good stuff. We're seeing all the bad stuff. There's just not any good stuff right now coming around. So, that's one of the things I'm talking about after this meeting, is talking to our employees about the benefits of make sure you're getting outside and you're eating right. So all this has been super, super helpful for me. So I appreciate it, everyone. And they're all good suggestions. Thank you.
Jen, thank you so much for being here today. Gosh, I'm sorry to hear that. And I just realized I had never checked the chat. Alani, there's a question about the Paleo Diet. What do you think about that?
A great question too. Just kind of like the ketogenic diet, it's a fad diet. That diet focuses heavily on protein, more lower carb, and a moderate amount of fat. And so there's good parts about all those different types of diets. The good part about the paleo diet, is that it focuses a lot on natural foods and avoids those highly processed foods. But you're limiting a lot of things too, like beans and legumes, dairy products, grains, which, we now know whole grains are really, really important for us. And so it's very limiting, kind of like the ketogenic diet, but in a different way. It still focuses on some fruits, not all fruits, a lot of vegetables, but no grains, no beans and legumes, which are so good for us. And so it's pretty restrictive as well, and it's not as well balanced as we want it to be.
So I think our theme from you today is the balance and the moderation.
Yes, yeah. Exactly.
Who can talk about collagen? Is this something beneficial to take for us? I don't know if that's an Alani or a Jaclyn question.
I can take it unless Jaclyn, you want to.
We can't hear Jaclyn because she's.
Oh yeah, Alana, you tell me about it.
Okay. So collagen, just like other kind of supplements, is not regulated by the FDA. And so we don't really know what we're getting, besides the fact that studies haven't really shown that it's really effective for much. Collagen is a protein that our body makes naturally. And so as long as you're, again, having that well-balanced diet, you're going to get the collagen that you need. It doesn't really affect kind of our hair, our skin, our nails, our replenishing our muscles. Studies really haven't shown that that's very effective. There's a lot of kind of, case reports that it has shown to be effective, but overall studies aren't really saying many great things about it in supplement form. So in general, having, a good amount of protein in your diet, or a well-balanced amount of protein in your diet, is your body's going to produce that collagen naturally that it needs, at any age, really.
Jaclyn, does that make sense to you? Are you going to verify her response for us?
That makes, she knows a lot more about collagen than I do. I actually take like a hair, nail, and I take one of those vitamins, but just with anything that's over the counter, any supplement that's over the counter, it's just not verified, that it really, that's why it says on there, this may help you with, because they don't know for sure.
Mm-hmm.
All right, so that's interesting because I'm thinking about, and we're about out of time, but since I'm in charge of this, I can continue to ask questions. So I've been spending every day staring at myself on video, on Zoom calls, and all I can see is my neck. What can we do about that? Did anybody read that book by Nora Ephron? Do you all remember her, that writer that she was so hilarious? She died a couple of years ago. Anyway, she wrote a book about there's something wrong with my neck as she aged. So what can we do about it? I guess plastic surgery, but beyond that.
Yeah, I mean, weights, lifting weights, like to keep your muscle tone good. And that helps with your spine. I mean, I'm sure Danielle can tell you about that as well. It helps with pain. Of course, using sunscreen. I mean, but we needed to be using sunscreen like starting in our, when we were 16 all the way up until now. So unfortunately, a lot of the damage is done, but you can still, help with the wrinkles with the sunscreen. And wearing, I wear a big brimmed hat, and so my face looks like a ghost face in the summer, but that's fine with me. I don't care. And just using, drinking water. I mean, water so much helps your skin. Just making sure you get enough water a day in, and that you're staying away from caffeine, which dehydrates you. I'm taking Alani's stuff here, I think. And then I use nice, the creams on your neck that help with they're kind of expensive, but I use them on my face, I use them on my neck, and essentially we all are aging, unfortunately, and then we need to find a good plastic surgeon, like you said, at some point.
Danielle, you're on mute.
Thank you. I don't think there's anything wrong with your neck, Ann, is what I was saying. But I'll just throw in one really quick tip. When you do exercise or whatever you're doing for your exercise, a lot of times our neck's kind of in this position. So really easy tip that I tell people is to tuck their chin and bring it back just slightly. And that actually kicks in some of your deep neck muscles for strengthening. So that way you're actually, you could be doing a bicep curl, but if you're here, you're not going to be strengthening those muscles just posturally as well.
Well, that's a good tip, huh? All right, everybody do it. I'm watching
Don't
everybody.
be like this. Be like this. Like a pie in the face.
Yeah, exactly.
And you have that.
Yeah, then we get the turkey, the double chin.
Right, that's right. So bring out the double chin to get rid of the double chin.
What other questions do you all have for our experts? This has been so interesting.
I have another question. Does anybody have any feelings about intermittent fasting?
I do.
I like intermittent fasting. I think it works. I think but I agree with Alani about the whole moderation thing. Like, I stay away from red meat. You got to exercise. I stay away from the high fat stuff. I do, fat-free dairy. I try not to have too much, like, I eat lean meats. Like I was telling before you guys all came on, I wanted to go into to be a dietitian initially. So I do sort of like know, I think, a good bit for my own self about what to eat. But I think intermittent fasting is good. Some people will say that it slows your metabolism down, but I sort of go back to the way that we were, like when we were first ran the earth, right? I mean, there weren't a lot of meat for us to catch. We were doing more fish. We were growing vegetables and fruits, right? And so I think we fasted quite a bit, probably because we were looking for food. So I think that fasting does play a role in your metabolism, but also it helps you to not overeat. It sort of resets your stomach a little bit, because I think sometimes, like, the feedback mechanism for keeping our stomach full all the time and keeping our blood sugar levels up, and then we do this, which is why you need carbs, right? A lot, like, throughout the day, right? You need carbs to have that energy and stay stable. But if you get too many carbs, then you're going to crash. If you eat that, like, Reese's peanut butter cup, and then, you're going to want more carbs. And then, so I think it's a good thing to reset. That's my opinion. Alani, I'm sure, knows way more than I do.
No, I really like that you what you mentioned, and I agree. So there's a lot of mixed reviews, or the jury is out in the research. A lot of studies show that intermittent fasting is effective and great, and a lot of studies show that it's not. And so what we kind of conclude with that is it's a case-by-case basis. Some people really, really respond to it, and some people don't. My recommendation would be not to intermittent fast on your own, but get medical supervision, especially by a provider and a registered dietitian, to make sure that you're doing it appropriately and safely, especially because there are some kind of diseases that you don't want to be intermittent fasting with. For diabetes, for example, you don't want to be intermittent fasting, especially if you're on medications that cause low blood sugars. That can be really dangerous. So, it can be effective, absolutely, but we also want to make sure that you're doing it in a safe environment where it can be most effective. And, trial and error is really, really kind of the key when it comes to intermittent fasting as well. So, I agree with you. I don't think it's a bad thing. We just have to be very careful and making sure that we have our medical team behind us when we're doing that, to supervise and make sure that we're doing it safely.
So I did take my DNA and I sent it to that Geno palette. Have you seen that?
Uh-huh.
Okay. So I took my 23andMe DNA and I sent it there, and they essentially told me, because I think that makes sense. To me, that makes complete sense, to base everything off your genome, right? Your personal genome. And if there's science behind it, it should make sense. So I did that, and it told me that I need to eat carbs. I need to eat more carbs, less protein, which I knew, because I can lose weight on carbs, but good carbs, not bad carbs. And limit fat. And what else did it say? I metabolize caffeine quickly, which I know I do, because I can drink a Coke like 2 hours before I go to bed and sleep wonderfully. It doesn't matter. So I think that was really interesting. So, food for thought, I guess, if you want to try that, if you're okay with giving the government your DNA, which I
don't even know what you're talking about. I know what 23andMe is, but what was that second step?
It's a Geno palette, right? Is that what it's called? PALATE. So you upload your DNA, which is all like, I don't know. I looked at it. It was like, 700 pages long. You upload it into their computer. Now, is it a scam or not? I don't know. But then they go back based on your genes. This is what you should be eating, what you shouldn't be eating. This is how you respond to alcohol. This is how you respond to caffeine based on your genes. And I think that's good. Seems like it makes sense.
I never heard of that. That's cool. Anybody else? Questions? We got the experts here. They won't hang up on us, I'm sure. Well, thanks everybody for starting your Friday with us. This has been so interesting. It's just, we here at the Chamber, we just keep trying things. So continue to join us as we move some things virtually, and I've actually learned a lot, and all these webinars on every subject in the world we keep doing, but I think they're interesting. So Danielle, thank you so much for all your help getting this organized and getting last years organized as well. Alani, so nice to meet you.
You too.
I'd love to meet you in person. Jaclyn, so great to see you.
You too.
Next month, we are moving from women's physical health to women's mental health is going to be our panel for our June webinar. I think it's June 12th. And Becca, wave Becca. Becca is going to be on there talking about the benefits of CBD. We've also got an acupuncturist coming on. We also have Marnie to talk about benefits of meditation. So we're going to talk a lot about different kinds of health issues. Well, not issues, how to deal with mental health issues and how to be strong in that sense as well. So trying to bring some alternatives to regular medicine to that. So I think it should be fascinating. So please mark your calendars and join us for that in a month. And meantime, stay safe and wear those masks when you go out. And I hope to see you all soon. Thanks again.
All right, bye.
Thank you.
Thank you. Bye.